Millions and millions of gallons of coffee are consumed in this country every week, most of it by the staff of this show. 80% of Americans say they consume some form of caffeine every day. But a new study shows caffeine is so addictive, many people suffer severe emotional and physical side effects when they try to stop. It's called caffeine withdrawal syndrome. Some doctors say it's serious enough to be listed as a psychological disorder. One man tells us about his battle with caffeine in his own words.
My name is Mark. I'm a 51-year-old nurse. I was in a study to try to get off caffeine. For 4 years, I've been addicted to caffeine, and during that time, it was 5 or 6 bottles of soda a day, up to 15 on some days. I just thought it was natural. Soda's just part of my life. I knew I had some tolerance to the caffeine, and I decided to just stop drinking sodas and see if I can just go cold turkey. I started feeling a little headachy, a little flu-like, but then it just got worse. Light was starting to bother me. I thought I was going to throw up. You just want to just curl up and die. I realized that the caffeine was the problem. It was kind of interfering with my work as a nurse. My wife saw this article about the caffeine study, so I said, well, what the heck? I followed their formula of kind of tapering down. It was hard at first, but after a while, it became routine. Since then, I think I might have had 2 sips from my son's soda. I feel better about myself. I think I'm better off.
We turn now to Dr. Laura Giuliano, a psychology professor from American University. She co-authored that new study on caffeine withdrawal, the one Mark just mentioned, with colleagues from Johns Hopkins University. Good morning.
Good morning.
Thanks for joining us for coffee and chat. Tell me about the study. What did you find?
Okay, so this wasn't one study looking at caffeine withdrawal. What we did was we systematically evaluated all the research to date that had been done on caffeine withdrawal.
Okay.
So we analyzed the research in order to determine the scientific validity of the syndrome. That is, is it a valid syndrome? Is it real? And what does the syndrome comprise? What is it comprised of?
It's a drug. Caffeine is a drug.
Yes.
And so ultimately, we're all medicating ourselves every morning when we eat.
It is the world's most commonly used behaviorally active or mood-altering drug. Now,
if anybody, even Kate was talking about, she's trying to cut back. Can everyone expect some form of withdrawal symptoms? And if so, what are they?
Well, what we did is we looked for symptoms that occurred reliably across many studies. And what we discovered was that we could put symptoms into about 5 basic clusters. And so the symptoms we've identified would be headache, fatigue or drowsiness, mood disturbances such as irritability and depression, difficulty concentrating, and flu-like symptoms, as Mr. Nicholson had described, which can include nausea, vomiting in some cases, muscle aches and pains.
Right. And would these symptoms be acute for, say, someone like myself who would, if I could, peel back my skull and pour the coffee right onto my brain? I mean, does it depend on how much you drink, depending on how acute the...
It depends a little bit on how much you drink. There certainly is a relationship. The more you drink, the more likely you'll experience withdrawal. But research has shown that it only takes a small amount of caffeine, about 100 milligrams a day, or about the equivalent of a cup of coffee or a couple of soft drinks, in order to show withdrawal symptoms when you miss a usual dose.
Right. Now, if this is a body trying to tell us something, should we be concerned about long-range effects? Is there any science on long-term effects of caffeine?
Sure. There's a lot of research on the long-term effects of caffeine, and there are no known life-threatening effects of caffeine. So when used in moderation, for most people it should cause no problems, as long as they get it regularly.
Right.
For some people it's not recommended, people who have anxiety disorders, sleep problems, certain medical conditions.
Right.
But for the most part, most people can use it without consequence.
We appreciate your efforts here this morning and the information. I'm now going to switch from double espresso down to Coca-Cola.